Skin health is very important, especially for people with physical disabilities. Joining us now to talk about skin health and preventing pressure injuries is Dr. Pamela Houghton. Thanks for joining me, Dr. Pamela Houghton.
Good to be with you.
Let's talk about the basics. What are pressure injuries and how can they happen?
So the skin is the largest organ of the body. And so our health is reflected in our skin health. It protects us from the environment. It helps us regulate body temperature and blood pressure. And it's full of sensory organs and nerves that keep us appraised of what's going on in the world we live in. It replenishes itself naturally, and it therefore can respond to damage by automatically repairing. But sometimes this barrier becomes breached, and pressure injuries represent one of the most common ways that the skin breakdown occurs. Pressure injuries are basically due to pressure. So it's an external mechanical force that basically squeezes the skin between two hard surfaces. So I like to think about, if you think about the skin over your elbow, you can feel the bone underneath,
right?
And that's one hard surface. And then if you lean against a chair or a bed, then the skin becomes squeezed. And if that pressure is too much, or it lasts for too long and isn't relieved, then the skin can begin to become damaged. It can overwhelm the repair processes, and you end up with what we call a pressure ulcer or pressure injury.
I appreciate you explaining that. Now that we know what it is, what are some ways to prevent these pressure injuries?
Yeah, so the best way to treat pressure injuries is to stop them from occurring in the first place. So one of the, there's lots of suggestions I'll make, but one of the most important, I think, is to do regular skin checks. So everybody's skin is different, and they respond to pressures and other forces differently. And so I think it's extremely important to do regular skin checks. In addition, keep moving. Pressure injuries are because we stay in the same place for too long. And so being active and moving from surface to surface, doing weight shifts, etc. Eating well and drinking fluids that keep you hydrated. So the better you eat, the more nutrition reaches your skin, the healthier the skin is. Watch for changes in weight. As we age, as we get older, the skin can, or our body weight can change, can get higher, we can gain weight, and that puts more pounds per square inch on each skin surface. But the other can also occur. We can lose weight because perhaps of an illness, or because we're just not eating as well as we should. And that too can increase the risk.
So a little back to the preventative measures. When you're facing all these changes in your weight and your body and your activity, what should you be looking for exactly?
So areas of, let me first talk about where pressure injuries are most often found. So you need to know where to look when you're doing your checks. And as I explained, because pressure injuries occur between, when the skin is squeezed between two harsh surfaces, they occur most frequently over bony prominences, or areas where your bones come closer to the skin surface. So the most common area are, especially in people who use wheelchairs, is your sit bones or your ischial tuberosities. So there are two bones that underlie the buttocks, which we sit on. So we want to make sure that we check that area. Other areas at the low back area called the sacral area is another prone area. And lastly, hips on both your left and right side are common areas where the skin is affected. So you want to check those areas. That will mean for many that you need to get onto a flat surface so that you can see and feel those areas of your skin. Perhaps you need to use a selfie stick with your cell phone so you can take pictures, or a long-handed mirror. And if you can't do it yourself, then get a caregiver who can regularly check your skin. Not only should you be looking at your skin, you should be feeling the skin, because skin breakdown can occur, but you can also get warm red or purplish spots that happen before the skin breaks down, and you want to pick those up as well. So change in temperature or texture of the skin is also something to watch for.
I appreciate you explaining that. That's definitely something a person with a physical disability has to watch out for. For my final question with you, Dr. Houghton, I'd love to ask you, what are some common myths and misconceptions about pressure injuries?
That pressure ulcers are not serious, that it's just a small red area, it's just a bump in the skin. And the reality is that the skin is the largest organ, and it's the most important for helping you fight infection. So if it isn't addressed quickly enough, infection can set in. That infection can spread to your bones, spread throughout the body, and death can occur in individuals with unresolved infected pressure ulcers. So thinking that a pressure injury is simply just a small red spot and will go away by itself is a myth I'd like to address.
I appreciate you calling attention to the severity of that, Dr. Houghton. Thanks for joining us, Dr. Houghton. And for more information on skin health, visit coretree.com.